Ever wondered if a seemingly harmless habit could have far-reaching implications? Well, buckle up as we delve into an intriguing research study from Australia that suggests a link between nose picking and Alzheimer's disease, the most common form of dementia. Alzheimer's disease is a complex condition, with both environment and genetics thought to play roles in its development. There is also a growing body of evidence suggesting that pathogens may contribute to its onset. However, the pathways by which these pathogens enter the brain have been a mystery until now. A team of scientists from Griffith University in Queensland, Australia, have discovered that a bacterium known as Chlamydia pneumoniae enters the brain via the olfactory nerve from the nose. This leads to the development of amyloid beta plaques, a characteristic feature of Alzheimer's. Now you may be wondering, how does nose picking factor into this? Well, the researchers suggest that nose picking damages the nasal mucosa, making it easier for the bacteria to reach the olfactory nerve and, subsequently, the brain. While nose picking is often seen as a harmless, albeit unpleasant habit, this research suggests it might not be as risk-free as we once thought. The study shows that in mice, damaging the nasal cavity allows bacteria to enter the brain through the olfactory nerve. Once there, these bacteria stimulate the deposition of amyloid beta protein, potentially leading to Alzheimer's disease. The olfactory nerve, which leads directly from the nasal cavity to the brain, provides a direct route for bacteria to bypass the blood-brain barrier. The study showed that Chlamydia pneumoniae, a bacterium known to cause respiratory tract infections, used this route to gain access to the central nervous system in mice. Professor James St. John, head of the Clem Jones Center for Neurobiology and Stem Cell Research at Griffith University, and a supervising author of the study, pointed out that while Chlamydia pneumoniae has been found in Alzheimer's plaques in humans, it is not known how the bacteria get there and whether they cause Alzheimer's or are simply associated with it. In this study, the same bacteria were observed to quickly travel up the olfactory nerve in mice and initiate pathology similar to Alzheimer's. Professor St. John suggested that many microorganisms could potentially contribute to the onset of Alzheimer's, possibly in conjunction with genetics. However, it's important to note that this is likely a slow process. The presence of bacteria in the brain doesn't mean one would develop dementia instantly. Instead, it's believed to set off a slow progression of pathologies that may take decades before resulting in symptoms. The researchers are now keen to see if these findings can be replicated in humans. So, does nose picking increase your risk of Alzheimer's? While the definitive answer is still out there, it's certainly worth being cautious. After all, early results on mice suggest that this habit may not be as harmless as we once thought. Take care.